when I read it, I immediately remembered what you were saying about the difference between reality and what these officials describe when they're there, right? So the article is entitled "Stop Using the Drug We Won't Name on COVID Patients," right? Do not use the drug we won't name to treat COVID-19. This was a warning from the Ministry of Health. This is a warning the Ministry of Health is sending to the public, especially to patients in home isolation. Speaking during the Ministry of Health's virtual news conference yesterday, Health Minister Terence Singh revealed that COVID patients in home isolation have been using the drug to their demise. Now, I don't know if he said to their demise, or the author of the article is saying now, but I think what they mean is to their detriment. I hope that's what they mean. Because anyway. This is the part in particular. The earlier you come in is the lower level of care you need and the better outcome you'll get. But when you wait too late and the ambulance goes 2 times, 3 times, your chances of having a good outcome are severely lessened, he added.
Right.
That is Terence Diaz.
That's what I was confused about, the ambulance going 2 and 3 times.
Well, that confused me too.
Right.
But the best explanation I could think of is, you know how when you're COVID positive and you're in home isolation, there's check on you. So I don't know if when they call you and they ask you.
Well, that's what it's supposed to do.
No, but I don't. They call. I know they receive calls. If
If a guy we went through that just the other day.
But they didn't get calls.
They get 2 calls.
Right. But let me say they got called on one occasion and they inquired, and they say, yeah, now things getting worse, you know. Then maybe that is what they mean. Maybe in an instance like that, the ambulance would visit.
Right. Oh, okay.
Maybe and if they know that you're one of those people whose symptoms, not abating, then they will check on you more often.
Right.
And then they will send the ambulance out. So maybe that is what he means. Or it could just be gibberish because, it's Terence Diaz saying. So, but the more important factor there, right? He is insisting, just now, he said something else. All right, and the principal medical officer, Dr. Mariam Abdul Richards, said private physicians have been misusing the drug. She pleaded, please, this is not WHO approved. This is not according to our treatment protocols, and we have seen negative consequences. We have seen persons die, present late. It is registered on their notes and confirmed that they use the drug we won't name, and the outcomes have been very poor, creating a lot of grief and distress to their relatives, who in many cases said they should have known better or regret the decision to go that route. I'm speaking here not just based on statistics alone. All right. Right. And please have confidence in the parallel healthcare system. We continue to try our best. That's the part I wanted to get at. Right? Trust the system. Now, the proponents of the drug we won't name claim that what it does is that it helps to stop the viral replication. So that's why it's important to take it in the early stages. Right? On onset of symptoms, or if you could get it before the symptoms, if you get a positive diagnosis and you could take it before the symptoms start to come, take it then. That is what the proponents say. And that's what the people who are being motivated to take, because it's the proponents they're listening to. They wouldn't hear about it anywhere else, right? So that's in their minds, that's what they are dealing with. Something that needs to be taken immediately, or else, because waiting until they reach hospital stage lose that time.
Yeah.
You just went through the situation yourself. I know several people who have. You present to the hospital with flu-like symptoms because you're concerned. COVID is going around. You want to know what's going on. What is the treatment protocol you're placed on?
Just let me hold 1 second. Babe, watch me fast. Can you remember the name of the drug they were telling you all to take after you got the test? Or the drug they wanted to give you all? It was some regular over-the-counter drug, right? There was one regular over-the-counter drug. I forget the name of it now.
Wasn't Panadol?
No, it wasn't Panadol. But it was one of them regular...
Paracetamol?
No, it wasn't paracetamol.
But what was it meant to treat? The cold?
Yeah.
The cold symptoms?
Yeah, the cold symptoms.
Okay. All right. Cool. So that's it. That's all and you go back home.
Right.
Right.
Yeah.
There is no treatment package you're given.
No.
Special medications that you're advised to take. Nothing. As a matter of fact, nothing is given to you to treat really the disease. It's really things to alleviate the symptoms.
The symptoms of
right.
Yeah.
So I know of people who've been prescribed Panadol and children's Panadol in the case of the child who was experiencing the symptoms. So in other words, if you have a fever, take a fever reducer. If you have pain, take a painkiller. If you have congestion, take a cold medicine. Take a cold tablet. That is what he is speaking about and saying, trust their early protocols. What is he talking about? So he thinks that without going to the hospital, people don't know how to treat a cold. What is he talking about?
Because the thing is, right, I was thinking about this the other day, like about 2 days ago, and I was thinking, okay, so let's just say I start to feel like I get COVID, right? I think one of the things, and I mean, this is no way health advice, medical advice. I was just thinking, right? Because one of the things that happens is you end up with inflammation in the system, right?
Right.
So one of the things I was thinking about was, what tablet or what can I take to reduce inflammation?
Right.
You understand what I'm saying? That was my thought process.
Right.
You understand?
So it's not even something like that happening.
Right.
They're not even telling you clotting is also an issue. So when with COVID patients, so they're not even putting you on a tinners. Right. To say, well, all right, well, we are really doing things that are going to help to alleviate the effects or make it harder for the virus to have a very harmful effect, to wreak havoc on your system, right? Because we're giving you anything like blood thinners or whatever, right? And I'm not saying they should, but they're not even giving you that. So when he says, trust the healthcare system, don't take the drug whenever, how is he addressing the fears of the people? Because those people would be inclined to take the drug because they've been told.
And let me be real. Most people, if you have some sort of symptoms, would already be taking the things they could tell them. Already.
Exactly.
You know how to tell them.
Because they know how to treat a cold. They know how to treat a cold. You understand what I'm saying? So what do you mean by trust? What you are talking about is what happens when you reach the hospital. But people are trying to take that drug that we won't name to not end up in the hospital. If we were in Florida and it was Ron DeSantis and he was saying, well, listen, don't take that drug, come and take Regeneron, the monoclonal antibodies, because that is an approved treatment and that has been shown to reduce hospitalizations. So don't go down that road of that wacko drug. Take this that we know works. And this, because that is early treatment. You understand? That's an early treatment protocol. Not getting your Panadol.
Exactly.
You understand what I'm saying?
Yeah.
So what shit you telling me? But again, it shows the disconnect between what they talk about when they come on that podium and what happens in real life in the healthcare system.
The next thing is the reason my wife didn't even bother to stay to try and get his drugs because, as I said in the last podcast, when they went, first of all, they had a 4-hour wait, and then they wait 2 hours in the can and 2 hours and change among a lot of people.
Suspected COVID
people
cases.
Who wanted to get tested clearly because they thought they probably had COVID, right? And then they had to go and wait again. Because I was telling them from the start, say, going on. Because even though they were sick the week before, they had already started to recover, right? They were. My daughter was probably about, I would say, 85% recovered. My wife was probably about 75% recovered, right? But as I say, we thought it might have been, anyhow, nevertheless. So I was like, listen, don't go and get COVID. Checking to see if you have COVID. Right?
So bust out.
Right, because you're waiting to get this tablet, and clearly, is a tablet you can get over the counter, right? So I was like, nah, don't waste your time.
Right.
And that's my point. At the end, is a tablet you can get over the counter.
And is not necessarily attacking the virus itself. It's simply treating with symptoms.
But to be fair, though, I'm not saying it right, Jude, but most people wouldn't know the difference. If you understand, most people wouldn't know what would treat the virus or wouldn't treat the virus. If you understand what I'm saying?
Right.
Because most people will be like, well, when I had the cold the last time, they know it's not the cold, but I don't know, for whatever reason, they might think the Panadol multi-symptom works, so...
Well, it worked to reduce this... Anyway,
Most people don't understand that. I tell people all the time, at the end of the day, when you take Panadol multi-symptom, it reduces the symptoms, you know. Yeah. It doesn't actually cure the cold.
Yeah.
Do you understand
it just reduces the agitation and the discomfort you feel
exactly
while your body is naturally fighting off the virus itself.
Yeah, but most people don't understand that. Most people don't understand. They think, well, no, I think that is heal, man.
Right.
Yeah. So,
but the thing is, the people who are using this drug, they would have been inspired and motivated to do so because they think it's part of an early treatment protocol. Right, and what they are trying to avoid is ending up interfacing with the hospitals.
And without you're trying to get them more Panadol because they're probably taking Panadol home already.
Exactly. So, what are you talking about? What on earth are you talking about? I'm talking in circles, talking about ambulance visit. Notice there was nothing there actually linking the drug we won't name to worse outcomes. They just keep saying that, but they're not, they're trying to insinuate that because they didn't come to the hospital fast enough, that's why they end up in that position. But that doesn't have necessarily have to do with the drug, eh?
Exactly.
That could have been the person was generally unwilling to go to the hospital.
And the next thing is, it could be that person started taking the drug when it's done bad.
Exactly. So nobody knows, and they're being very careful in the wording there because they can't. I would suspect that they can't really link the drug we won't name to a particular
case,
a particular type of outcome, a particular type of damage or hurt. Because if they could, they would simply say this does this, and when you take it does this.
And trials have shown, I mean, obviously outside of the COVID situation, where they gave people up to, I think they said 20 times the dosage, and there wasn't any noticeable damage done to the person.
No, well, they could say that would have been done outside of when the person wasn't sick.
Right.
So so a healthy person took over the 20 times the amount and nothing happened to them. That doesn't mean that if you're sick and take the even the recommended amount that it mightn't. But from all I've heard, I haven't heard that proven. I haven't heard anybody say, well, no. If you take this when you have COVID, then it isn't harmless like how it normally is. It can do because while your body's fighting the virus, X or Y or Z is the case, you take this, you're putting yourself in a worse scenario.
Yeah, adding more inflammation. Yeah, you're thickening your blood even more, or anything like that.
Precisely. I've heard nothing like that. And I would suspect that if they could prove that, they would say that. But they can't. So they just... But again, that's not even... I'm not here to lobby for the drug we won't name. I'm simply pointing out this is the difference between the reality and what them just talk on the podium. What treatment that you should trust? Your wife is not the only person, and that's how I knew what happens. You present with flu-like symptoms. You can't even find out if you have COVID immediately. You can't even get...
Okay, let me not even say immediately. In 2 days, you
can't find out, right? So, and as far as they're concerned, once you can walk, talk, go back home. Go back home and take things to treat your symptoms. That's the only care. That's the very good parallel healthcare system that these people should trust.
That when they can tell if you have COVID.
Exactly. After 2 weeks, I might even get back a call to know if I was positive or negative. That is what I'm supposed to trust.
The thing is, there are people who will tell you that their symptoms went from just a normal cold to real bad in a split second.
Of course, in
no time they would take
in morning and in afternoon. It was
problems breathing. So the way you're talking about when you wanted them to come,
exactly.
When you send them home,
exactly.
3 days ago. But anyhow.